Good morning. So I want to welcome you all to this MS Views and News, MS Symposium here in Coleman, Alabama. I'm saying it like that because there are people online right now as well. So we want to thank everybody for being here, and I want to thank our wonderful sponsors. So we had, supporting the program, is SANDOZ, which is a division of Novartis. And our exhibitors, we had Alexion, Banner Life Sciences, Biogen, Bristol-Myers Squibb, EMD Serono, Genentech, Novartis, SANDOZ, and Viatris. Why don't we give them a round of applause for supporting the program? Thank you very much. For everybody that doesn't know, my name is Stuart Schlossman. I too have multiple sclerosis. We have Bess Martin, who's a physical therapist, doctor of physical therapy. She's a Mississippi native. She went to the undergraduate at Mississippi State University, then went on to attend physical therapy school at the University of Mississippi Medical Center, graduating in 1991. She has worked in a variety of neurology settings throughout her career, but the last 15 years has been focused on multiple sclerosis as a MS certified specialist, currently resides in Birmingham, working at Alabama Neurology Associates, and Bess will be speaking with you for 30 minutes, followed by a 15-minute Q&A. Thank you.
Okay, thank you. Can everyone hear me? I think, okay, I had to lower, I'm a little shorter, as most people can determine, so I had to lower the microphone. Anyway, I'm so glad to be here today. I appreciate all the great questions. We obviously have a very interactive audience, and I appreciate that. So, like Stuart said, I have been working with MS for, like 32 years. And so I really enjoy speaking with people who have MS, caregivers, family members, just about how to help manage your symptoms better. And it can, because the symptoms can be widely ranged, and so it can be a really challenge to manage your symptoms with MS. So today I'm going to talk to you a little bit today about the various symptoms, and there's a lot of symptoms, as you all know. But I'm going to focus on these top 8 symptoms that are here. So the symptoms that I'm going to present on are the kind of, and it can be frustrating with multiple sclerosis symptom management because everyone presents differently. What symptom you might have, your neighbor may not have. It may present one day, it be a problem, the next day it may not be a problem at all. So it can be a wide range of symptoms. It can be a wide severity of symptoms, but hopefully today, my goal of today is for everyone here to just take home one little tip, one little trick that might help you manage one of your MS symptoms a little bit better. So just so I'll know who I'm talking to, who in here, if y'all can raise your hands, tell me, has anyone ever had physical therapy before to help manage any MS symptoms? Okay, a few people have, good. So hopefully I can help explain maybe how maybe you can modify that physical therapy, or even if you don't choose to have physical therapy intervention, maybe you can try to take a few tips and tricks home and just manage it a little bit better yourself. So the first two are fatigue and heat intolerance. Those are very common ones. They're kind of known as the hidden symptoms. Vertigo, balance, spasticity, muscle weakness, gait abnormality, and ataxia. So I'm going to kind of hit the high points. Again, it manifests itself very differently in everyone. So hopefully you can take home some little tip or trick that might be helpful to you. Okay, so the first thing we're going to talk about is fatigue. And generally with fatigue, it is such a common symptom of neurological diseases, and it really affects more than 75% of people with MS. Who in here has fatigue? Anyone? A lot of people. It really is. And so it can be kind of broken down into 2 different parts. There's primary fatigue and then there's secondary fatigue. So primary fatigue is really the fatigue that you have because of the disease process itself. Because of the lesions in your central nervous system, your nervous system is really having to work twice as hard to reach the same end, so you can get that primary fatigue. But because of the primary fatigue, it's hard for you to get up and move around. It's hard because of your mobility issues. It can be hard for you just mentally to make yourself move. You can get some secondary fatigue, or that fatigue from deconditioning. And so that's something you can really have an impact on. Oftentimes this fatigue can be compounded by sleep disorders. We just heard the last speaker talk a great deal about sleeping, and if you're having frequent urination, you're getting up multiple times a night. Maybe you have spasticity in your legs, that restless leg feeling, you're not sleeping well. So if you're not sleeping, that can increase the fatigue maybe that you're having. Of course, medication side effects can make you lethargic. That deconditioning is what we're going to harp on and we're going to talk about next. Depression can impact fatigue, and also the heat sensitivity, which is a whole nother process I'm going to talk about. So we're here in the South and it's a real problem right now. So as far as the treatment of fatigue, there's different medications. You can talk with your doctor. You may be familiar with a lot of these different medications that are often prescribed to help with fatigue. There's also something you can think about with energy conservation. And when I say energy conservation, I don't mean sit and don't move to conserve your energy. What I say by energy conservation is you want to be wise with how you use your energy. So if you're working, you want to do everything while you're on this side of the office or this side of the building. I want to take care of all the activities over there. Or when you're around your house and you're doing chores, I want to not spend a lot of time walking back and forth and back and forth. This can be kind of hard because my next thing I have written here is to organize your physical space. So you may have to literally write down on your to-do list, kind of help you organize and think about your activities of the day. So you want to use your energy wisely and also kind of be very organized with how you do your activities each day. So the thing that generally people ask all the time, oh my goodness, I have so much fatigue, what can I do? This is one thing that you can do in order to have a positive impact on that secondary fatigue that I was talking about. I like to use this example for people who don't have MS. Let's say you go on a really long car ride and you're sitting in the car and you've been riding in the car for about 5 or 6 hours. Well, you get out of the car and you're like, golly, I am exhausted. But have you done anything to make yourself tired? You haven't done any physical movement. You haven't done any activity. You haven't worn yourself out. You've just been sitting. So in order to get energy within reason and in a safe way, you have to use energy. So that's the best thing that you can do to help with your fatigue. So I suggest doing maybe a stationary bike, a new step, or walking on outdoors, or even walking laps in your house since it's so hot right now on a scheduled time, set a timer. Make yourself walk a little bit more in your house, maybe aquatic activities. But the ticket here, and you're going to hear this theme throughout my whole talk, is consistency. So if you get up and you want to say, I'm going to walk or I'm going to move, if you have your rollator is a great activity because you can always sit if you get tired, or if you're at a park and choose somewhere that has stops along the way, maybe a bench or somewhere to sit on. But the ticket is going to be to do it consistently. So if you get up and you do your consistent activity, you're riding your stationary bike or whatever you may choose on a Monday, and then you don't do it again until the next Monday, you're kind of always starting over. You really would suggest do it for shorter periods, but more often to have a greater impact. So that's one thing that you definitely can do to help that secondary fatigue. And also heat management is a whole nother topic that we're gonna bring up next, because heat is a very real thing. So as far as heat intolerance, there's a big word called Uthoff's phenomenon. Anybody ever heard of that? Dr. Uthoff kind of came up with the first one to recognize this heat intolerance that goes along with MS. They don't really know why patients with MS have a heat intolerance. It's generally thought along the same lines as a fatigue. Your nervous system is working twice as hard to reach the same end. So therefore you can, build up this heat intolerance, and it can be a real problem. I'm sure that there are some people here today at our talk that felt like they couldn't even get out to come today, so they had to do listen to our talk online. So it can be very problematic. Research has shown that even a 0.5 degree increase in your core body temperature can cause you to have a temporary increase in your symptoms. So when we talk about heat intolerance, getting hot does not cause you to have more lesions in your central nervous system. But it can cause you to have a temporary increase in your symptoms. It can be kind of scary. You might be walking around minding your own business, and all of a sudden when you start getting warm, maybe your foot drop increases, start dragging your foot more. It can really be a scary thing. So this is something you really have to learn how to manage, especially now, living in the South. It can be a problem by living in the South. It can be getting out of a hot shower. It can be just increasing your core body temperature with some of those exercises that I just talked to you about that you need to be doing. So what are some things that you can do? Well, in order to manage it, you can get some type of cooling equipment, a cooling vest, neck wristband, really cool your core body temperature down. I have some of my folks take a really super cold shower before they're going to exercise. They might use a fan on a pole when they're sitting on their treadmill or sitting on their stationary bike. Exercise at this time of the year, maybe if you have the ability to go to a mall or go to a gym or just in your house, like I was mentioning earlier, just walking laps in your house while you're indoors, that can be a great thing to do. So it is a very real problem. You're not dreaming that you have it, but you have to figure out how to manage it, because you can't. I just tell people it's really hard to turn into a hermit in the summer and then come out of your shell when it turns, because around here it's not going to get cool until November. So it's really a long period of time that you have to be in hibernation if you really can't figure out how to manage your heat. There's a lot of different places. MSAA has got free cooling vest. If you get on their website, lots of different organizations will offer cooling equipment for free if you financially qualify. So I'd encourage you to kind of check out those different websites. Okay, so the next symptom we're going to talk about is vertigo. And that's just kind of that, where you have dizziness or your world just feels like it's at a tilt, and there's different types. There's peripheral vertigo or central vertigo. And peripheral vertigo, just kind of sparse those out, is the type of vertigo that you get when you have these little crystals out in your inner ear, and when the crystals roll around on the cilia or the hair-like follicles in your inner ear, it can make you have a temporary increase in vertigo. This is what you treat this by going to a physical therapist or your doctor, and they do the Epling maneuver, and they move your head around in all these different ways, and they get the crystals back in, and you're fixed. Generally, the type of vertigo that is more problematic with people with MS is the central vertigo. It is more long-lasting, it is fairly constant, it doesn't really come and go, it's not really with a certain position, but it is a very big problem. It can impact your balance, it can just make your world pretty miserable. A lot of people use scopolamine patches, they use all kind of things to help with this central vertigo. It can be accompanied with nystagmus, which is where your eyes, you might have seen people, your eyes kind of twitch, I guess, for lack of a better word, but it can be a problem with your mobility and can become a really big issue. So it can be hard for me to make a general statement about the treatment of vertigo because it is very specific. So it can be helpful if you can see a therapist or a physical therapist to do an evaluation to determine what kind of initiates your vertigo. Is it when your eyes move only in certain ways? Is it when your eyes and head move? Is it when you're minding your business and things are coming past you, like in a car? There can be many different things that can provoke your central vertigo, but the treatment is these habituation exercises. And it can be, I'll just be honest, it can be kind of miserable to treat vertigo, because what you want to do is we're going to do various eye exercises. So I might have you either in sitting or in standing. I'm just going to kind of skip forward and talk about it all at once. So you might be sitting or you might be standing, and I might have you do exercises where you're slowly moving your eyes only in different directions, either side by side, vertical, horizontal, diagonally, or I might have you move your head and eyes together, just doing different things, and the goal is to provoke your symptoms. So what we do is by provoking the symptoms with consistency with this, you can dampen the sensitivity of your vertigo. It's kind of like if you rub your arm and you keep rubbing your arm and you keep rubbing it, eventually just gets kind of numb to it. That's the same theory. If you consistently move and do these eye exercises, you can dampen the sensitivity of them, because we're smart. Our brain's very smart. Whenever you turn quickly and you get really dizzy, what do? You don't turn your head. So therefore, anytime you do turn it, it really stirs it up, and it can be a really big problem. So it's no fun. I'll just be very frank. It's no fun to treat vertigo, but it can be very impactful and can really help dampen those symptoms with again, you need to consistently walk or going to consistently work on the vertigo. Consistency can be really very helpful. Okay, so along with vertigo can also impact your balance. How many people have ever had balance trouble? That's just kind of with MS, it's with aging, it's switched across the board, everything. And so balance is kind of defined as the need to accomplish coordinated movements. It can be when you're sitting. Some people have difficulty with their balance, even lying down or in standing. So it can be in a variety of positions. And generally, with balance, it's very complex. So balance involves the cerebellum, which is the balance center in your brain. A lot of people may have a lesion from MS, specifically in their cerebellum, which can be problematic. We also use our vision to give us a sense of balance. If any of you have ever kind of used a stable spot, stare at the floor when you're walking, that gives you that gaze stabilization, or if you stare at a certain spot on the wall, that can really help you with your balance. We use proprioception, which is a big word, and all that means is just your sense of groundedness, or the pressure in your feet. Does anybody have trouble when you're walking, you're doing fine, and then when you get on thick carpet or get on grass or something like that where you don't have as much pressure in your feet, it can throw your balance off. And also strength is an important part of balance. So those are kind of the four big things. So if you have difficulty with maybe a lesion in your brain, your vision, that pressure, that groundedness, or when you have decreased sensation in your feet, it can really make it very challenging to walk. And then your strength, because if you think about it, if you have a really weak leg, or if you have foot drop or something like that, it's really hard to hold your balance up when you're kind of having to fight and use your strength to hold yourself up. So balance is very multifaceted. I'm going to kind of sparse through those as we move forward, but the general theory is if you have balance difficulties due to maybe difficulty in your cerebellum, or just you don't really have strength as a problem, but just overall imbalance, the principle is going to be you must challenge your balance, but do it safely. So what are some things that you can do in order to help your balance? So what I have a lot of my folks do is you have to challenge it, but do it in a safe environment. So I might have people, if you think about it, if you're getting balanced, what do you naturally do? You get this wider base of support. You stand with a really wide stance because that makes you feel more stable. Well, that kind of gets to be where you're stable, where your baseline is. That's where you like to be because that's where you feel comfortable and safe. But if you can put yourself in a situation where you are in a position to challenge that balance, you can definitely improve it. So I might have you stand in with your feet together. I might have you stand heel to toe or standing on one leg, maybe do eyes open or eyes closed. When you close your eyes, you're making your cerebellum have to work more. So therefore it kind of increases other things and takes away that dependence on your gaze. So you just have to play around and look specifically. Maybe a therapist can kind of help you, or you can kind of weed out what is the major problem with your balance. A lot of times I have people do balance while you're walking. I'll have people do functional activities, maybe reaching down, picking up something off the floor, looking up, reaching up in cabinets, walking, looking left and right. Just as long as you're in a safe, kind of controlled environment, balance generally tends to acclimate into the environment which is placed. So if you're always standing there with your legs really wide, a really wide base of support, and that's kind of where you are, then your balance is not really, in order to improve it, it will be very helpful if you can kind of mix it up and challenge it in order to get it a little bit sharper. A lot of times I'll change the surface that you're standing on. I have a lot of people tell me I can balance so well if I'm really thinking about it. But the minute I quit thinking about it, I lose my balance. So I'll a lot of times add dual tasking or a cognitive task where you have to We're going to have you call out certain things while you're walking or while you're maintaining your balance, because that can make it more functional. So therefore, it makes it more reality-based to be able to hold your balance while doing things. And a lot of times, it's kind of a little out of order here, but a lot of times I'll have people stand in the corner. I used to have people always stand in front of their sink, but I found that people are holding on more. So now I'll have people go in the corner where you've got a wall on kind of the right and left. You're not touching it, but when you're practicing these things like closing your eyes or standing heel to toe, if you lose your balance, you just kind of bounce off the walls a little bit and you're kind of boxed in and you're in a safe environment, so you can feel confident about trying these different things. Maybe standing on a pillow, standing on a less firm surface to uptrain your balance, to challenge it a little bit, to help it kind of rise to the occasion a little bit more. Okay, so research also tells us that in order to improve your balance, that it can be helpful to do these balance challenges more often for shorter periods of time. I know generally they always tell us that with exercise you need to do it 30 minutes a day, 3 times a week. That's the good old mantra that they've always used. But specific with the balance, if you can maybe more frequently go stand in the corner and kind of challenge your balance, they've found that can have a little bit more impact rather than setting aside a long period of time just once a day. So that's kind of my general rule of thumb as far as balance goes. So spasticity can be another problem with people who have MS. It's defined as just a velocity-dependent Resistance to muscle stretch, it can be accompanied by clonus, and that's that if you've ever seen anyone or you happen to be able to put pressure on the ball of your foot and you get that rhythmic kind of jumping that can kind of accompany, that's just clonus. And so you can or cannot have that with spasticity. From my experience, spasticity can vary tremendously. It can be all the way from just having a lot of Charlie horses, cramps in your hamstrings, things like that, all the way to irretractable spasms where you just kind of have a lot of stiffness and you can't seem to move at all. It can be very painful. What wakes you up, a lot of times it tends to raise this ugly head in the middle of the night. You mind your business, you're lying there and your legs start twitching or jumping, and it can really be more problematic at night. The pro to spasticity is sometimes when people have a lot of muscle weakness, it can give you some stiffness. You can actually use it to your advantage to maybe help you stand up. But the con can be if it's too much or if it's too stiff, you can't sleep, you can't move, you can't sleep, and it can be more problematic for you to walk because you're really moving that very spastic, heavy limb when you're moving. So there's pros and cons to spasticity, but then what do you do about your spasticity as far as treatment? Well, there's different medications that some people might be on. The pro is they can help decrease your spasticity, but the con is sometimes they can make you sleepy. So that's not a very positive thing, but I think if you can play around with your dosage, a lot of people acclimate to it. So if you start out at small dosages and increase, it can be helpful. Botox is something that people use a lot of times just with the individual injection at a certain spastic muscle group that can help decrease that. The main thing I'm going to harp on here is doing some stretching and range of motion. I'll kind of make this general statement. I don't know how many in here in the room might be taking baclofen, Xanaflex, or Valium, any of those muscle relaxers for your muscle spasms. But if you are not consistently performing stretching along with that, in my opinion, you're really only getting half the benefit because your medication is going to decrease or dampen the initiation of the spasm, but your muscles are still probably going to be tight or shortened. So if you accompany that taking of that muscle relaxer along with a stretching program, you will have a better impact and it will decrease usually the pain that you're having. A lot of times if you position yourself properly in a chair, if you're in a wheelchair, sometimes it can help decrease that spasticity, and also weight-bearing activities. And what I mean is, if you think about it, you wake up in the middle of the night and you have a Charlie horse in your leg, what do you want to do? You hop up out of bed and you stand on it, you walk on it, it dampens it a lot of times, along with stretching. So getting on hands and knees, on your knees, standing on your legs, a lot of times can help decrease that spasticity if possible. And then if you're, of course, yoga is just kind of a higher level activity. This can be very helpful as well, if you're able to do that, to help as well with that. So there's lots of different things you can do to help your spasticity. And along with that, sometimes can come pain. Pain with that tightness, pain with spasticity, the neuropathic pain. It affects about 20 to 40% of people who have neurological diagnosis. And it occurs in more than half of the people with MS. It's a very real problem. You can have that primary pain, which can be like the nerve tingling and all that kind of stuff that a lot of people have with the dysesthesias, paresthesias. You can have the MS hug. Most of my folks that have MS hug say whoever termed that really chose a poor name for it because it's like a vice grip in your trunk, but that MS hug is just the spasticity that occurs in those intercostal muscles, so stretching and things like that can help with that. And then if you've ever had trigeminal neuralgia, that's just that's a no joke as far as the pain goes. So you've got those primary sources of pain, but then you've got that musculoskeletal pain that can happen as well with it. So what do you do for it? Well, of course, there's different medications that you can take. Again, I just mentioned stretching and positioning. I will say pretty much across the board, anyone that comes to see me for any reason, I always give them a stretching program. And if you're wondering, what type program you can have, therapy, a therapist can help you design one specifically for you and the problems that you're having. Maybe PT, we could do modalities, maybe do ultrasound or deep trigger point release or different things like that to help manage some of the pain that you're having. Compression garments. Now, our last speaker was talking about the benefit of compression garments to help with the swelling in your legs, and that to help with your bladder control. Also, you can use these compression garments as a secondary thing to maybe help if you have this neuropathic pain, that your nerves feel like they're on fire, your feet or your legs are burning. A lot of times a light pressure or light compression can help dampen that pain that you might be having from the neuropathic pain. Botox can help. So there's many different things that you can do to kind of help with your pain. And I feel like I'm kind of going 90 miles an hour, but I want to get through all of my different symptoms. So the next thing I'm going to talk about is the treatment of muscle weakness. So a lot of people, and it can vary a lot. One day you may be having trouble if you're really warm or really hot with your with muscle weakness, and another day you may not be having much trouble at all. But most people that I see with MS have had some experience with a little bit of muscle weakness. And you can, of course, do a traditional exercise program where you're doing the weights or the Cybex or the traditional things that you might have experienced in a gym, and that can be helpful. But oftentimes I find that more weight-bearing or functional exercises can be beneficial as well, or maybe even more so beneficial. Because a lot of times, whenever you're going to do the traditional exercises and you're lifting weights or doing your weights, you may not necessarily feel yourself getting stronger as you did before, because there is an impairment with the message getting down to the muscle group because of a lesion or demyelination that might be going on. So I like to do more functional things because it kind of helps connect the dots. If you do stair climbing or step-ups or gait or squats or things like that, or sit to stands, those are things that your body recognizes, and it kind of helps connect the dots from your brain down to the extremity where you're having that weakness. So we'll do exercises on your knees, on tall knees. We do a lot of core strengthening with Pilates or planks. Yoga, like I already mentioned, can be beneficial. There's also something called constraint-induced therapy. Dr. Taub at UAB is the one who started this, and it's kind of the general premise is if you have a weak extremity, but you do have some active movement there, if you put a mitten or you can strain your stronger side and require your weaker side to work for periods of time in the day, it will help impact that kind of learned disuse or that deconditioning that happens because your stronger side is always taking over. So that's something that also can help as far as with your muscle weakness. Okay, so the next big one that everyone who comes to see physical therapy across the board, everyone wants to maintain their ambulation. And if you think about it, it's kind of the building block for everything. It's when you want to walk to your closet to get your clothes, walk to the bathroom, walk to the kitchen, do all your things, you have to be able to walk there. But ambulation or gait is very complex, and it's a combination of many, many, many different things. Pretty much a combination of everything that I mentioned so far. And so you really have to address the deficient areas. You have to kind of weed out what is the main problem. Is it balance? Is it muscle weakness? Is it that I have vertigo? Or is it my spasticity? There's so many different things that can impact your walking. So you really kind of have to address the primary dysfunction and kind of weed out a little bit more. So there's many different things that you can do to treat your gait abnormality. Maybe specific gait training, and I like to use looking at normal gait as a rule to treat maybe abnormal gait. But based on that, a lot of times I'll recommend maybe using an assistive device, a rollator or a cane or something like that. And I know a lot of people are like, no, I don't want to use that. I don't want to get dependent on it. But oftentimes I found in people who have MS, just because at certain periods of time, when you're using an assistive device, that does not mean that you are going to be using it forever. It can oftentimes be the means to an end, because if you're having such balance impairment that just throwing your gait off a lot, if you have just something like a rollator or a cane to kind of give you a point of contact, it can kind of help your brain understand more normal gait without having to worry about all the other things that go along with it. So sometimes I do recommend an assistive device, and it doesn't have to mean a permanent use of that assistive device. A lot of times if you have foot drop or limb weakness, you can use different kind of braces and AFOs, they used to be old school plastic kind of things you put in your shoe, but now they have a lot of carbon fiber options that can be utilized to help with leg weakness, ankle weakness, and knee weakness. Walkout and bioness are that function, they call it functional electrical stimulation, where you put a little cuff around right below your knee and it stimulates that anterior tib, that muscle there, in order to contract simultaneously while you're walking at the right time. The disadvantage of those is they're expensive and insurance does not cover those, but I've had a lot of people get some help with different nonprofits to get those covered. So you can also have a free trial with a rep with those to see if that would even be an option for you. Or the Sabo step, which is pictured here with that little blue shoe. It's just kind of a old school. You put a cuff around your ankle and you hook it to some little grommets on your shoe, and it will kind of help you lift your foot if you're having trouble with foot drop. Also, body weight supported treadmill training, which is where they put a harness system over a treadmill. We've used that before. And also, again, multitasking, so that you kind of don't necessarily, people talk about how they can maintain their walking while they're thinking about it, but then whenever they quit thinking about it, they lose their whole sense of gait. So a lot of times in therapy, I will do dual tasking activities, or activities where you're doing more than one thing at a time. Okay, so my final symptom I'm going to talk about is ataxia. And ataxia is just generally what we term as a decreased coordination of movement. It's disorganized, unsteady. Some people have ataxia if they're going to kind of reach for something. They have a really hard time maybe eating, doing their activities of daily living, grooming. It can be at any joint or body part. You can have ataxia in your trunk. You can have it in your leg when you're trying to place it when you're walking. You can have it when you're reaching. It really varies tremendously in its presentation. But if you do have ataxia, the thing you're seeking is stability. You're really wanting to have that grounded stability. And so the thing you don't want to do with ataxia is you don't want to go on an uneven surface. I would never put somebody on a ball or on any type of really moving surface if you have ataxia, because you're wanting stability. So weight-bearing activities can be helpful. Using wrist weights, ankle weights can be helpful. For people who have ataxia, a lot of times medications are provided by your physician to help with that. Deep brain stimulation, where a lot of times people may be familiar with that with Parkinson's, but it can be used for ataxia. Some of my folks just have to use, in order to literally eat their meal, because their ataxia is so severe, marijuana and alcohol has sometimes helped dampen that ataxia to make it a little bit more manageable. And also we have a thing in our clinic called balance-based torso weighting. It used to, back a long time ago, 30 years ago when I started practicing, we would just put a weighted vest on someone and it would just generally make you heavier. But this balance-based torso weighting is more of a 1/2 or 1 pound. At the most I've ever put on someone is maybe 2 pounds, and it's strategically placed weights to kind of counteract if you kind of are having more difficulty going one way. We might put a small weight on the opposite side of your of your trunk, in order to help overall give you a greater sense of balance. So it's a pretty complex evaluation that has to happen, but it definitely has been impactful for a lot of people who have ataxia or other balance abnormalities. So anyway, I know I've blown through so many symptoms, and I know it's probably like you've been drinking water from a fire hydrant, but it's I hope that I can maybe shed some light on some symptoms that you might have, and maybe some things that you might can do to help with your symptom management. I know I would suggest whoever has MS presents very differently. Symptoms present differently. The severity of them is very different. And so it can help to have a physical therapy evaluation, or you just to really look specifically at a lot of the symptoms that you might have, and kind of prioritize, I guess. Most people have more than one symptom. Most people have many of them. And so it can be overwhelming sometimes. So hopefully you've learned a few little nuggets of information or knowledge that might be able to help you.
Thank you very much, everybody.
Yeah.
There we go.
Oh, thank you.
Thank you. All right, so first one, regarding the vertigo, what do you do for the people who, there are times like you could turn your head looking to the right or to the left, and you actually feel like your entire body is still going that way, even when you're not. You're now looking forward, yet your body still feels like it's looking to the right. that can happen while driving. I know it's happened to me. I know it's happened to others, where I look to the right, and even though I look left, the steering wheel is now going to the right also. A little dangerous, wouldn't you think?
So as far as vertigo goes, I mean, honestly, there's many different things. I personally suggest, I definitely have that happen, or people mention that to me a lot. So I like to do treatment, of course, away from when you're driving in the car, but you might do it when you're, so what you have to do is you have to provoke the symptoms. So when you're not in the car, or when you're in a good, stable, safe environment, it may have to be sitting, it may need to be standing, but you have to challenge it. So what happens is we choose symptoms when you're turning your head. So we might do exercises. It would take kind of an evaluation to see exactly what's provoking those symptoms. But I would have, if I find that when you're standing and if you turn your head right and left quickly, or at any speed when you're turning your head right and left, what you have to do is you have to continue to do that. So by turning your head away from when you're in the car or when you're in a safer environment, it will generally, if you consistently start out slower, but you increase that repetition and increase the speed of shaking your head right and left, it will generally dampen the sensitivity of that. I know it's terrible though. I mean, it's an awful thing to have to do, but it's the reality.
Thank you very much. Next, can physical therapy help with neuropathic pain, burning sensation?
So as far as PT for neuropathic pain, I would say generally what I found that helps the most is, like I mentioned, most of the time I suggest like compression type garments. So that's the first thing that has been generally successful. Oftentimes, just by I've also had success with people who have neuropathic pain by just doing movements. Because if you think about it, similar to, like I was just talking about the vertigo, when you do move, your legs and all kind of feel like they're on fire. It tends to increase circulation. It increases blood flow, which oftentimes can exacerbate or make your neuropathic pain a little bit worse. So I do a couple of things. If someone comes in with their primary problem, I will try to do more active movement within reason, maybe be more consistent but slow with it. Also, if their neuropathic pain is more sensory related, where when you're touching the extremity, it tends to make it a little bit worse, I will prescribe starting out with different textured like a cloth, like a washcloth or something soft. And again, you have to dampen the sensitivity. So I might suggest if your legs feel like they're on fire every time you touch it, that you can start out by rubbing with something soft or brushing your leg with something soft, and generally gradually increasing that as you can tolerate, just to desensitize the sensitivity of the touch, if that makes sense. So there's a couple of things. You can do it by external stimulation, by using a variety of different types of materials to lightly rub the extremity that might be really hypersensitive, or you can do activities to increase blood flow to the area. Now, of course, in the immediate, it can be hard to do because immediately when you're doing it, it can elicit some pain, but you're in charge generally of how much you do. So it's a subjective ability to be able to tolerate it. And so as you increase your movement, or as you increase the touching or rubbing of that extremity, it will generally decrease the sensitivity of it.
Thank you. Next, recommendations for scoliosis seems to be more and more common in later disease.
Yeah, generally scoliosis is just problematic as we age, like everything. If you started out when you were 15 years old and you had a little 10-degree curve, as your trunk muscles get weaker, or as you have changes in your gait, particularly if you're using a single-handed device and you're always going toward one side, you're going to tend to kind of do that. A couple of things that, now if it's a fixed scoliosis, meaning that your bones are fused, I guess, in that position, is going to be hard to impact, and that would be something you might have to go see an orthopedic surgeon about. But as far as generally a non-fixed scoliosis, a couple of things I like to do is I like to stretch if you're the opposite side. If your curve is like the C curve, on the shorter side, you can do some lying on your side, maybe have a towel roll or a roll underneath that side to do some side stretching of the trunk muscles, and also do some core strengthening to kind of help strengthen the weaker side or the longer side and shorten the other side. So the strengthening of the trunk and stretching.
Thank you. Next, when an MS hug occurs, is there anything I could do as her partner to help ease the pain for her at that time?
Sorry, when an MS what occurs? I'm sorry.
When an MS hug
Hug. Okay.
occurs,
Yes.
is there anything that can be done?
Yeah, generally with an MS hug is generally just where you have spasticity of your rib cage, or they call your intercostal muscles, or the muscles that are between your ribs. So when you do have an MS hug, most of the time, again, my kids say that I think that stretching will like cure cancer, but it really does help. So because I feel like I've said that 1,000 times with every problem that there is, but generally what you can do in the short term, if you are having an MS hug, is try to just do some stretching. So it could be in sitting, where you do the lateral leans and you're taking your opposite arm overhead. Just anything that you can do to stretch your intercostal muscles will help.
Thank you. What can you tell us about ataxia, and is this also feeling like you're high-stepping?
You can't, if you have ataxia in your leg. Ataxia it varies in its presentation, but a lot of times may understand it as you may have seen people when they're going to reach for something and they just can't control their arm and it's kind of all over the place. That's really what ataxia might look like in its more severe forms. But it can be present in your leg. So when you're going to walk, when you go to lift your leg, if it kind of feels like you're stepping off a cliff or you don't know where to put your leg down, or it's kind of all over the place and uncoordinated, but yet when you land on the floor, it gets a little bit better. That can be one way that ataxia can manifest itself with your walking or in your legs. So generally I like to do things in weight bearing because again, you're seeking stability. So when people who have ataxia, I'll do more activities maybe on your hands and knees, on your knees, standing in squats, doing a lot of strengthening to strengthen those muscles around that extremity. Also sometimes kind of for a quick fix, you might can try a small weight, like maybe a 1 pound ankle weight on your extremity to kind of see if that helps it land in a little bit better spot. You don't want to get too heavy with that because it can be hard to lift your leg if you get too heavy of a weight. But again, also that thing that I was mentioning earlier, that body-based torso weighting, the weighted vest sometimes can also help with that.
Okay, next, does Elavil help to reduce control neuropathic pain?
Does what? I'm sorry?
Elavil.
Oh, Elavil. That's one of those things that I was going to say you have to ask Dr. Legank a little bit differently. I mean, he might have more of a knowledge base. There's many different medications that are used for the neuropathic pain, and so that's one of those things I would just defer to your doctor to talk about.
Great. What can you tell us about when people start an exercise program and they tend to overdo it and they get more fatigued when trying to do it? What can you tell us about that?
Yes, that happens oftentimes because when you first get started, maybe after you leave here today, maybe I've, given you a pep talk and you're like, okay, I'm here. I'm going to start doing it. I'm going to start exercise, stretching. But I do agree, and this is kind of a tendency for all of us. You kind of get excited about it and you get going and you may overdo it. So I like to suggest, and then what happens is you don't want to go back and do it again because you're like, oh my gosh, this exercise just caused me to have a relapse, when it really didn't. It just caused you to have so much fatigue that you didn't really want to do it again. So I oftentimes like to kind of start out, I would say, almost underestimate your abilities. And even if you feel like you can do more, for example, if you're going to be on the treadmill or you're going to do stretching or you're going to do any kind of weight training, I would suggest maybe doing 5 reps. Or I'm going to get on this stationary bike and I'm going to do 5 minutes. I know you could do more, but I would rather you do 5 minutes 4 or 5 times a week than 30 minutes once a week and feel like you have a feeling of accomplishment rather than overdoing it and kind of it backfiring on you. So I think that consistency for shorter periods is going to oftentimes be more beneficial than kind of biting off more than you can chew, because I'd rather you do it often than do too much and not go back and do it at all.
What can you tell us about compression garments, and do they benefit those that have stinging or burning sensations above the knees?
Yes, they definitely can. As I mentioned earlier, it really depends on, I know the lighter compression, 15 to 20 millimeters of pressure, it's a lighter support. A lot of times people who have, because we're in the South, we're hot, all that kind of stuff, a lot of times people don't want to use the stronger compression, and the stronger compression might be beneficial for people who have a lot of swelling, but specifically for people who have that neuropathic burning, you can use a little bit lighter compression. I've seen them on Amazon, seen them many different places, but maybe 15 to 20 millimeters can be beneficial to give that consistent pressure without being too tight.
Okay, thank you. And can physical therapy help with double vision?
With double vision? Well, I guess
Yes.
it depends on why you have your double vision. So a lot of times people have double vision because they have maybe a lesion on their optic nerve, they've had optic neuritis, things like that. So I guess as far as double vision, really I would think that physical therapy might help as far as you could give it a try, some of the eye exercises, to see if maybe the double vision might be due to something else in some other, I guess, option that might be limiting you, but you can give it a try and see if some of the eye exercises might help dampen the double vision.
Okay, thank you. Next one, is it OT or PT that's needed to help with weak hand issues?
With hand, what was the first one? Oh, hand issues,
OT
yes.
or PT
Well,
for
actually,
weak hand issues?
Yeah, well, really both. I know as far as physical therapy, we are trained in everything from like head to toe. Traditionally, occupational therapy is designed for specifically to give you maybe any modifications or adaptive equipment that might be helpful if you do have hand weakness. So I know we have an OT in the clinic where I work as well, and so we kind of work together. So as far as hand weakness, I would say OT or PT both could address that, but if you also might need some adaptive equipment, that OT might be more knowledgeable about maybe weighted spoons or cuffs or different types of plates or different adaptive equipment that might be available out there.
Great. Regarding the foot brace to walk better, where would a person find these products?
Okay, I would suggest, as far as a foot brace for walking better, that you do two things. I would definitely suggest that you go see a physical therapist first, because a lot of times in order to get the brace to fit properly, you might need to do some type of stretching. You want to make sure that your range of motion and things like that are in order, because if you have a decreased ankle range of motion, no brace is really going to fit you properly. So after you go to see a PT, just to kind of make sure all of that is in order, I like to go to an orthotist. And I refer my patients to different ones in Birmingham we have that are recommended, but you want to go to a knowledgeable orthotist, because generally, I'll just tell you, the ones that you private pay for, like the Sabo step or things like that, now you certainly can get those from Amazon or from Sabo directly, but if you're getting an orthotic, the thing that goes inside your shoe and you're wanting your insurance to pay for it, generally insurance will pay for about one every 3 to 5 years. So you want to be sure you're using, you're going to someone knowledgeable who knows about it, that you're getting the correct one that fits you properly, who will kind of go back and forth and try this one, and that you're not stuck with it. We'll try this one out. I don't tend to go to, if I'm going to recommend someone getting orthotic or getting an AFO, I do not recommend going to just a durable medical equipment company, a mom and pop shop where they sell walkers and all of that. I tend to go to the companies that do only orthotics and prosthetics, such as maybe Hanger, Biotech, Alabama Brace, ABC, companies like that. That's who I recommend, because they're a little bit more knowledgeable about the various types.
Going back to the burning and stinging sensation question from earlier, would a TENS unit help?
Yes, definitely TENS can help. So what TENS can do, I don't know if you're familiar with those, but it's just a 4 different electrodes, a kind of a lower dose electrical stimulation. Definitely TENS, what it can do is it can kind of mix up the signals. So if you're having neuropathic pain in your limb or maybe in your back or in your arm, you can just kind of put these electrodes at different spots, kind of surround the area of pain and turn it on to your tolerance. And it can oftentimes kind of help dull or mix up the signals that you're getting. So it can definitely be a great option as well. Yes, great question.
Okay, thank you. And then is it recommended for spasticity and extreme pain that trying to use and apply any kind of pressure?
Spasticity and what pain?
Just pain.
Oh, yes.
Extreme pain.
Yeah, okay, yes. With spasticity, again, it can be very painful. And so when you're stretching is the primary thing, usually combining that with medication. Most people do both. So if you're on a muscle relaxer and you combine that with stretching, you definitely want to have a sustained stretch for about 20 to 30 seconds. So I am a believer in lesser repetition, but longer holding of the stretch. So if you have a muscle that seems to be tighter and have a lot of spasm in it, if you can hold that stretch for 20 to 30 seconds, you get a lot better outcome than a lot of quick stretches. And and you definitely want to, it can be kind of holding it kind of in that end range of motion that you can tolerate is beneficial.
Thank you. I've heard from several that during the night they get extreme pain in their legs and their calves. First one, and then they jump out of bed, and then the other one tightens up as well. And that sometimes that pain travels way up into the thighs and maybe attacks all the way up into their groin area with such intense pain that they don't know what to do other than scream their heads off. What do you say for these people?
Most of the time, I would recommend spasticity tends to, it seems like, raise its ugly head at night. Because if you think about it all day long, you've been going, your muscle fibers have been shortening and lengthening and shortening and lengthening. Then when you go to lie down at night, they're in a state of rest. But if your muscle fibers are shortened, that's an environment where it's very easy for a spasm to happen. So my primary suggestion for people who have muscle spasms primarily at night, most of the time they're going to start in the calf. Because if you think about it, when you're lying in your bed, your toes are pointed, which makes your calf muscles come closer together, which is an easy environment for a spasm to happen. So usually I recommend prior to going to bed, if you can do, just be sure to take your muscle relaxer and accompany that with some gentle stretches, calf stretches. And again, I've been talking about all these stretches, and that can be, I can be speaking French, I can be speaking a foreign language. Some people think that, when they're stretching, oh, but I'm doing calf raises. I'm like, no, that's making your muscles actually contract. That's not stretching. So you really might need to go see someone for a very specific stretching program. It can be very beneficial. A lot of times you might find some different programs on, YouTube or anything that you might combine with stretching. But stretching prior to bedtime will lengthen your muscle fibers and oftentimes will help inhibit the initiation of muscle spasms at bed.
There's also, I believe, a device made of plastic, whatever, and Velcro, whatever it is. Anyway, it holds your foot in one position all night, so that way you cannot flex one way or the other, and preventing that pain as well.
Yeah, that can be helpful. A lot of people can't tolerate that. It's just not comfortable because it's like you're sleeping with a cast on your foot. But it can be very beneficial to decrease that foot drop at night.
It's a lot less pain to wear that than to get one of those intense organs.
Very true.
Yep. I agree. Very much so. All right, last one that I have for all those cane users out there. You can't just go to a store and buy a cane. Should it not be fit for your size? Yeah,
generally, I would agree. A lot of canes are one of those things that insurance doesn't really cover anymore because they're a lower cost item. They're not very expensive. So generally when you are adjusting a cane, a lot of people theoretically, I would say the biggest misconception is people think if they get their cane higher, it's going to help them stand up taller and walk straighter. And that's not usually the case. It usually just makes you bend your elbow more. So generally you want to set the height of your cane around your hip level, where your hip bone is, where you have about a 20-degree bend in your elbow. So just a slight bend in your elbow, because in order to stand up straighter, you're going to have to use your back muscles or stretch the front of your body or use your muscles a little bit more. So a cane is primarily used just for a point of contact, but the correct height for a cane will be right around the hip level with a slight 20-degree bend in your elbow.
Great. Thank you very much. We are finished with your segment of the program.
Thank you.
Awesome.
I appreciate it.
Thank you very much. I do want to say thank you again to everybody that's online, and thank our supporters, all of our sponsors. We mentioned them all earlier, and that's it. Time's over for all of you online. Thank you. Have a great day.